Good morning all. I am Dr. S. SanthaKumari, Assistant Professor from the Department of Public Health Dentistry. In this session, I am going to brief you about the international health agencies. In this session, the content of this topic, which includes introduction, governmental agencies, non-governmental agencies, intergovernmental agencies, about WHO, its origin, constitution, structure and its work, global oral health data bank, etc. Moving on to the introduction part, as we all know, health and diseases have no political or geographical boundaries. As we all know, the apt example for this is COVID-19. Disease in any part of the world is a constant threat to other parts of the world. So, this could be the origin of international health work. Today, I am going to brief you about international health organizations and their activities in this session. International health agencies or organizations are helping the world to prevent disease and promote health. It was said by Dr. Paul Russell, nothing on earth is more international than disease. So, beginning from the health agencies around the world, in recent years, a vast network of public health units have evolved to cater the public health, among which the smallest units serve the small rural areas, whereas largest units like WHO organizations concerns the health of entire world. The international health organizations are broadly classified into governmental agencies, non-governmental agencies, intergovernmental agencies. Governmental agencies are supported by public taxations and operated by national or state government. Non-governmental agencies are legally constituted organization which is operated independently from any government, which means it acts according to its own regulations, whereas intergovernmental organization functions based on agreement between the nations. Moving on to the non-governmental organizations, it is a group in which their members are individuals or from associations, excluding the government representatives. The popularly and widely recognized governmental organizations are International Red Cross and Red Crescent Movement, Rockefeller Foundation, Ford Foundation, Co-operative for Assistance and Relief Everywhere. So, beginning from the intergovernmental organizations, I have given you a few popularly known recognized organizations such as Pan American Health Organization, International Labour Organization, the World Bank Group, Food and Agriculture Organization, United Nations Children Fund, World Health Organization, Colombo Plan, United Nations Development Programs. Intergovernmental organization refers to an entity created by a treaty involving two or more nations to work in good faith on issues of common interest. Next comes the non-governmental organizations. It is a term originated from the United Nations. It is an organization that is neither a part of the government nor the conventional organization which is run on profit businesses. Non-governmental organizations operates independently from any government by excluding government representatives. It may be funded by governments, foundations or businesses. According to the United Nations, any kind of private organization that is independent from government control can be termed as NGOs, provided it is not for profit, non-criminal and not simply an opposition political party. In many countries, NGOs also called as civil society organization or non-profit organization, otherwise it is called social benefit organization. Next we will discuss about the International Red Cross and Red Crescent movement. It is the world's largest international humanitarian movement which with approximately 97 million volunteers, members and staffs worldwide. It was founded to protect human life and health, and also it ensures the respect for all the human beings and to prevent and alleviate the human sufferings. The principles that are adopted by these organizations are humanity, impartiality, neutrality, independence, voluntary services, unity, universality. The next is the Red Cross Society of India. It has a network of over 700 branches throughout the country. It provides reliefs in times of disaster or emergencies, which promotes the healthcare of vulnerable community people. Thus, these organizations create a congenial environment for peace. It was established in 1920. The main objective of this society is promoting health and preventing diseases. The activities which are undertaken by this Red Cross Society are social and relief work, supplying essential items in need of time, and maintenance of blood banks, services to maternal and child welfare, medical care for defense forces, family planning services, and first aid services. The next famous foundation is Rockefeller Foundation. Actually, it was started by John D. Rockefeller, a philanthropist. It was started in the year 1913. It was originally started for medical research and public health education. Later, it was extended to the fields of life sciences, agriculture sciences, and humanities. Training of competent research workers, scholarship for Indian researchers, setting up libraries in medical colleges, assistance for agriculture and family planning rural health areas are the sponsored programs offered by the Rockefeller Foundation. Next, widely recognized foundation is the Ford Foundation, which is an American private foundation with the stated goal of advancing the human welfare. Purpose of this foundation is to reduce the poverty and injustice, strengthening the democratic values, promoting the international cooperation and advancement in the human achievement. The next foundation is CARE. It is expansion of CARE is Co-operative for Assistance and Relief Everywhere. It is the largest private humanitarian organization which was established in 1945. Over the years, their work has expanded to address the world's most threatening problems such as hunger, famine, and primary health care. It has got more than 12,000 members to serve the poor people. The largest care activity in India is the midday meal program. Particularly for the school children. It is also providing help in the sectors of agriculture, medicine, and education. Moving on to the intergovernmental organization, I have mentioned the core area or thrust areas where these intergovernmental organizations are concentrating. The first is the Pan American Health Organization. It is committed to ensure that all people have access to the health care they need with quality. The next one is the World Bank Group, which assists financially for the healthcare services through various organizations. The third one is the United Nations Children Fund, which is widely called as an UNICEF, which was previously called as the United Nations International Children's Emergency Fund. It basically focuses on programs that gives a long range of benefit to children of developing countries. Continuing the intergovernmental organization, ILO was created in 1919. The goal of International Labour Organization is to advance the social and economic justice by setting international labour standards. The main function of the other organization, Food and Agriculture Organization, is to provide help to all nations to fight against poverty and to raise the living standard of people. Next, we will move on to the core part of this topic, WHO. WHO is a part of the United Nations that focuses on global health issues. This organization has been working for over 60 years on issues such as smallpox eradication, family planning, childhood immunization, maternal morbidity rates, polio eradication, and AIDS, etc. Recently, COVID-19 also included in these activities. The WHO outlined several initiatives for better world health. These activities include working towards a universal health coverage, developing international health regulations, increasing access to the medical products, researching factors such as social, economic, and environmental issues that contribute to the health. Preventing non-communicable diseases is also one of the important duty of the WHO. And putting emphasis on Millennium Development Goals such as combating poverty, hunger, diseases, illiteracy, environmental degradation, and discrimination against women are the global issues dealt by the WHO. Basically, it was originated in the year of 1946 by 61 government. Origin of WHO, it was born on 7th April 1948. It is an international organization with the working language of English, French, Chinese, Russian, and Spanish. The membership in WHO include, it is open to all countries with non-self-governing territories as associate members. The main duty of this WHO to maintain the international peace and security and developing a friendly relation among the nation and promoting the social progress and also better living standards and human rights. Actually, it was originated when diplomats met to form the United Nations in 1945 after the World War II. One of the things they discussed was setting up a global health organization. Thus, they made a constitution on 7th April 1948. Currently, the WHO has got 194 member states. Moving on to the constitution of WHO, the WHO constitution came into force on 7th April 1948. It is a date we now celebrate every year as World Health Day. The constitution of the World Health Organization is a text of 20 pages that was adopted by the parties to promote cooperation amongst themselves and with others to promote and protect the health for all people. The constitution of WHO says that attainment by all people of the highest level of health, which is the objective of WHO. The next comes the 2021 theme. Observing the World Health Day is considered important because it is the opportunity to draw the attention of the world towards a specific health problem and raise awareness about it. Every year, a different campaign is proposed and stakeholders work towards achieving it. So 2021 a theme is this year, building a fairer, healthier world for everyone. This theme highlights the inequality in health services. Moving on to the structure of WHO, which consists of three principal organs. The World Health Assembly is the WHO's highest level of decision-making forum. This is the Health Parliament, which is headed by the Director General, and it is appointed by the World Health Assembly every year. The delegates from all member states convene at the World Health Assembly to set the priorities. World Health Assembly determine the policies of WHO. The member states elect the Director General who leads the organization in achieving its global health goals. It supervises, reviews and approves the programs and budget. Moving on to the next level of WHO structure is Executive Board. Though the governance takes place through the World Health Assembly, which is a supreme decision-making body, the Executive Board, which is the one that gives effect to the decisions and the policies of the World Health Assembly. Members of this board are to be technically qualified in the field of health. The Director General appointed by the World Health Assembly is appointed only on the nomination of the Executive Board. Thus, the Executive Board or the Cabinet implement the decisions of the World Health Assembly and advise the World Health Assembly regarding, and also it facilitates the work. The next level of structure is Secretariat of the WHO structure, which has got more than 8,000 health experts in the Secretariat who are specialized in their field. Apart from that, WHO Secretariat includes experts, staffs and field workers. The role of these staffs working in regional countries advise their ministries of health and other sectors on public health issues and provide support to plan, implement and monitor the health programs in their respective regions. Next, we will see about the regional offices of WHO. In order to meet the social needs of different areas, WHO member states are grouped into 6 regions. Each region has a regional offices. They are Africa, America, Southeast Asia, Europe, Eastern Mediterranean, Western Pacific. It has got its own headquarters. So those headquarters are mentioned in this slide. The regional offices are integral part of WHO, which plays an important role in implementing the policies and programs of the WHO. It is headed by the regional director and assisted by member of secretariat. The regional directors are appointed from the corresponding regional offices. For the region of Southeast Asia, we have got the headquarters in New Delhi. Continuing the regional offices, we have to see the responsibilities of regional offices. They have to maintain and formulate the policies of the region and monitor the regional activities. Very important, one more designation of the regional in the regional offices is resident WHO representatives. The type of job these of resident WHO representatives are, they will monitor the activities of the WHO in the country. They will support and guide the government in health planning and keeps the WHO informed or updated of any special health programs that are occurring in our country. We will see the responsibilities of the headquarters who are responsible for the biological standardization of any biological substances, and they also assess the efficacy of methods and materials, and also they are responsible for the control of diseases and control of general policies and finance that are concerned with the public health issues. So moving on to the staff of WHO. This is the first, the slide shows the first level of staff organogram of WHO. The topmost head of the WHO is Director General Dr. Tedros Adhanom Ghebreyesus, who is the present Director General, and he is the principal advisor to the United Nations on matters pertaining to the global health. It is the responsibility of Director General to establish the staff structure within the budgetary limits. The staffs of WHO includes experts from various fields of specializations to supervise the works of specialized unit. In this context, Dr. Soumya Swaminathan was appointed WHO's first chief scientist in March 2019. He is a pediatrician from India and a globally recognized researcher on tuberculosis and HIV, etc. Let us see now the agenda of WHO. The agenda of WHO addresses 6 points. They are 2 health objectives, 2 strategic needs, 2 operational approaches. All these objectives, strategic needs and operational approaches are aimed at neglected vulnerable people, and also these objectives are aimed at controlling the disease outbreaks and giving priorities to research works, etc. Let us see the objectives, 2 health objectives of WHO. They are promoting development and fostering the health security, and strategic needs involves strengthening health system, harnessing the research, information and evidences. And the 2 operational approaches of WHO are enhancing the partnership and improving the performance. Let us move on to the work of WHO. Actually, these are the important work done by the WHO, which I have given in a nutshell. They act as a directing and coordinating authority on all international health work. Also, they prevent and control any specific diseases that are outbreaking in a particular region. And they also develop comprehensive health services, family health and environmental health. They deal with the health statistics, biomedical research, health literature and information, and also they cooperate with other organizations to maintain the international health security. So next we will see about the key WHO publications. The key WHO publications are the World Health Report, International Travel and Health, International Health Regulations, the International Classification of Disease, International Pharmacopoeia. They also have their own journals like Bulletin of WHO, Weekly Epidemiological Record, WHO Drug Information. WHO is concerned with the dissemination of health information and its statistics through its publications and journals. So this type of publication and journals helps to disseminate the health information to the public. Apart from this, in order to help students and researchers in the field of medicine, the Southeast Asia Regional Headquarters has got a well-equipped library, and it has connection to the PubMed and the National Library of Medicine databases. Let us see about the Global Oral Health Databases. The main function of oral health databases are gathering oral health information from regional or member states through the surveys and compare it with other countries with standard methodology. Actually, this global oral health database was established in the year 1956 as a oral health unit. In the year of 1966, it is developed into a global oral health data bank. They have designed to record the surveys in a standardized format called WHO Basic Oral Health Surveys, which are very much useful for the epidemiological surveys. In 1996, they have started Internet Online Oral Health Database. Also, they have got WHO Oral Health Country or Area Profile Program, which is a database which provides information of individual countries and access to the important databases, for example, PubMed and WHO technical programs. We will move on to the Colombo Plan. The main objective of Colombo Plan is to create a cooperative economic and social development in Asia and Pacific countries. It was started in the year 1950. It helps in assisting the agriculture and industrial development sectors, and also it helps the health promotion. Finally, we will move on to the organization United Nations Development Program. Otherwise, in short, we will mention that as an UNDP. It was started in the year 1945, which has got its headquarters in New York City, USA. The United Nations Development Programme serves as a main source of funds for technical assistance to both developed and the developing countries. The main objective of this organization, it helps the nation in strengthening their natural and human resources. It also helps to achieve sustainable development goals, and it helps in funding the agriculture, education, health and social welfare sectors. So finally this slides brings me to the end of my discussion. Though India shows significant advances in healthcare system, still we have remained ineffective in providing the basic minimum healthcare services. The National Health Policy envisaged the PPE, that is Public-Private Partnership, and the CSR, Corporate Social Responsibility System, to strengthen the healthcare services. All these changes will need to be based on strong political will and economic and social reforms. With that, I end my session. Thank you for the patient listening.